I'm going to be moderating the panel today. I have a distinguished lineup of people to speak about a very unpleasant topic. Here with me today is Sara Arnold from the Family Law and Cannabis Alliance. I also have Yamileth Bolanes, who is the founder and president of the Greater Los Angeles Collective Alliance. I'm more germane to our topic today, an organ transplant survivor who uses medical cannabis. And I also have Stacia Cosner from SSDP, Students for Sensible Drug Policy. So I want to invite you guys to come on in, have a seat, and we're going to get started with this topic. I'm going to start with just a few introductory comments about overcoming stigma and discrimination in the field of medical cannabis, and then the speakers are going to talk in greater detail about their individual situations on this topic. And of course, stigma is a bias people bring, whether it be about a person or a thing or a situation. Stigma is a very common human condition, and in fact, we're all guilty of having associating certain people, things, or situations with stigma. Stigma is not to be confused with, of course, discrimination, which are actions we take. So stigma are the opinions we hold, and discrimination are the actions that we take. The origins of stigma are based on our personal, our beliefs, our values, the prejudices we bring to any given situation, and we do all bring them, no matter how hard we try, and also our perceptions. And I put perceptions here because perceptions are really crucial, because experiences we have, we interpret, and those interpretations and perceptions help build in us the stigmas and the biases that we have. But there are also some external things that play on stigma and that speak to this. Our experiences, our life experiences, social mores, even the peer pressure around us, all sort of influence the kind of stigma that we might have and might bring into a given situation. I should also point out, not on the slide, but just as important, our political strategies and tactics that are designed to stigmatize certain people, like medical cannabis patients, in a political context, and therefore to justify laws or policies that are discriminatory. So the significance of stigma in this context is that stigma is what we use to justify discrimination. If we stigmatize people with differing sexual orientations, differing ethnic backgrounds, or different economic backgrounds and economic situations, that stigma then lets us have policies and engage in behavior that keeps those people in a subjugated or in a discriminated against status. And so that's why stigma matters, and it matters that we overcome it, because stigma is the very root of discrimination, whether that be in medical cannabis or in any other field. And we certainly do know that medical cannabis patients are facing pervasive discrimination and indeed pervasive stigma all over the United States. There are stereotypes about cannabis users that apply both to medical and non-medical cannabis users. They're lazy, they're maybe a little bit irresponsible, they dress shabbily and have their hair too long, these sorts of things. And all of this stigma exists in the context of medical cannabis. We always have to remember that for most of the people in this room, I dare say all of the people in the room, cannabis has connotations that are very positive for us. It's about health and about healing. It's about a political cause for which we're fighting. It's about a loved one or about yourself feeling better when you use it. But for a lot of other people, there's a different kind of connotation to cannabis. It might be associated with youthful rebellion or indiscretions. It might be associated with legal complications or with aspects of a loved one's life with which you disapprove and blame cannabis. And so all of these things are a part of that, and all of this are the underpinnings of discrimination that we face. At Americans for Safe Access, we opened in 2002 a hotline, a toll-free hotline for patients to call and just tell us what was happening. And one of the first things we noticed is that in addition to legal problems and access problems, people were having discrimination problems. And over these last 10 to 12 years or so, we've noticed 4 primary areas where discrimination is a challenge for patients. And this seems to hold true in varying degrees, no matter what state that we're talking about. This is discrimination in housing, in parental rights, in access to health care, and also in employment. And these are very serious issues that patients deal with when they're when they're using medical cannabis or providing it or working in the industry. Many people know already from widespread media coverage that medical cannabis patients in some states can be fired from their job, even if their use is legal. We also hear from patients who are denied housing or denied the right to use or to grow their medicine in housing, depending on what their circumstance is. We have folks who have lost custody of their children because they use medical cannabis or grow medical cannabis. And we also have really tragic situations where people are denied equal access to their health care. This primarily deals with pain medication, people denied the right to use their opiate pain medication because they also test positive for medical cannabis use. And really tragically, one you're going to hear more about today are organ transplants. One of our members, Mr. Norman Smith, actually died after being denied an organ transplant when he tested positive for legal medical cannabis. Now, before we move on to that, there are some states with laws that protect people who use medical cannabis. If you'll have a look at a report published by Americans for Safe Access, you can find it on our website. It looks like this in real life. One of the criteria we graded each state on was whether or not they have both criminal and civil protections for patients. And some states are doing better than others when it comes to protecting the civil rights of patients and protecting them from discrimination. For instance, in terms of organ transplants, which I just mentioned, there are 6 states that actually have in their law protection for medical cannabis patients who need an organ transplant. In these 6 states, patients cannot be denied an organ transplant based on their medical cannabis use. Notice that is only 6 of the 35 states in the District of Columbia that have some sort of medical cannabis law that protect organ transplant patients. The story is a little bit better with employment, but not much better. We have here 8 states that protect patients who use medical cannabis from being terminated, although that protection varies, of course, across a spectrum. So it's by no means universal protection for employment. I want to mention briefly California. The California experience on employment was very telling. Our state law, Proposition 215, which is now known as the Compassionate Use Act, was silent on issues of civil protection. And so in 2008, the California Supreme Court ruled in an ASA appeal to the Supreme Court, Ross versus Raging Wire Telecommunications, that if the voters of California had intended to protect medical cannabis patients from employment discrimination, they would have included it in the law, which was actually referred to by one of the leading legal journals in the state as the worst decision of the year in 2008. Obviously, voters weren't thinking, I don't think it occurred to many people that if you were criminally protected in California, you would still be subject to employment discrimination. And at that same year, we actually passed a piece of legislation through the California legislature to fix that situation and to create those employment rights. That was Assembly Bill 2279, authored by then Assembly member Mark Leno. He's now in the Senate. And that bill was vetoed by former Governor Schwarzenegger. So thank you, Arnold. And that we've never been able to get that bill back through the state legislature. It's just has always proved elusive to get those last few votes. And so to this day in California, patients do not enjoy protection for their employment rights. The reason I bring this up is because legislation is one of the strategies, of course, we'll be mentioning as a tactic to overcome discrimination. Also in my home state, we have the organ transplant issue. One of our members died. Numerous others are in jeopardy. One of them is here today to talk to you. We have a bill in the legislature. If you're from California, I hope you'll join me in supporting AB 258. That's Assemblymember Mark Levine's Medical Marijuana Organ Transplant Act. This act will prevent an organ transplant center or a doctor from denying an organ transplant based solely on medical cannabis use. So that will be a huge step forward for a small but very vulnerable part of our population. So this is an ongoing issue that we're having that has very much has real world implications for the people who are facing discrimination and their loved ones. I hope what we're going to dig into a little bit today are the things that we can do to overcome stigma and discrimination. I've listed some of them here. This is not an exhaustive list, but I think the things that bear mentioning primarily are the one-to-one interactions and the exposure that help us break down stigma. If your perception of a cannabis user is that they're lazy and slovenly, maybe a little bit irresponsible, meeting responsible, upstanding citizens who are using medical cannabis can have a huge impact on overturning that stigma. And that's why it's really important that in our personal lives and at work and at church and amongst our peers that we're modeling good cannabis behavior and good cannabis stereotypes as opposed to reinforcing some of those things. And so I know that people have many things they're doing in their life, but being a good cannabis and medical cannabis ambassador is going to help with virtually all of the strategies to overcome stigma on which the discrimination is based. I also put on there, and I'll highlight, patience and tolerance. This is a very long process. And in order to overcome stigma, we sometimes have to meet people where they are, which requires a lot of patience and a lot of tolerance for people who are coming at us with some antiquated or inaccurate ideas about who cannabis users are and medical cannabis users are. So, did we go? Oh, yes, and there's two others. Let's see, did we go? There we are. There are two more. I'll put in bold type at the bottom. These are the things that we're doing together organizationally, and that is legislation and litigation to end discrimination against medical cannabis patients. So those are important tools in our toolbox as well. So, whoops, little spacing problem there, but some of the takeaways here and some of the things that I think are going to come up in the next three presentations is that ending discrimination is a long-term process. It takes a really long time to change these laws and to make a difference. It's important to remember that the Emancipation Proclamation was signed in 1863, and we didn't have the Civil Rights Act until 1964. It took more than 100 years to take that battle that far, but we also have to remember that the battle for racial equality in the United States didn't start with the Emancipation Proclamation, and it did not end with the Civil Rights Act. And so this is a really, really long fight to stop discrimination, whether it be in civil rights or marriage equality or gender issues or if it's in medical cannabis. And so I don't want folks to feel discouraged when, for instance, you see a bill in California lose 4 years in a row because this is a long, long fight that we have. We also have to remember that ending discrimination is our... Wow, the spacing went really terrible in these slides. My apologies. Ending discrimination is the unfinished business of the medical cannabis movement. I know there is a perception that medical cannabis is more or less finished in some places. And I want to assure you, even in California, where we are approaching 19 years of medical cannabis, we still have unfinished business. Exactly. When it comes to housing and employment and access to health care, we are not done with this work. And just because your city or your county has dispensaries and grow permits, that does not mean we have finished the work until we've protected the patients from discrimination. And finally, wow, that just keeps getting worse. I just want to point out that the issues around discrimination and stigma are relevant both in the cannabis and in the medical cannabis world. And that's very important for us in California as we're rushing to be, for the first time, not the first. Now we're somewhere in the middle of the pack when it comes to legalization. And also for the states that are looking as well at legalization already have legalization. That this issue of discrimination also applies outside the context of medical use. And I think the next frontier that we're going to see post-legalization in the states is a fight for the rights of cannabis consumers against stigma and against discrimination. And so we have to be aware of that as well. So without further delay, I'm now going to turn over things to the panel who are going to talk to you about some of these issues very specifically. We're going to start our presentation with Sara with FLCA to talk about family law and discrimination in terms of parental rights. So Sara?
Hi, I'm Sara Arnold, aka Sara Khan. I'm the co-founder of Family Law and Cannabis Alliance, or FLCA, and I'm going to be talking to you today about parenting, pregnancy, and child protective services, or CPS. Oh, there's a lot of stigma over pot and parenting. First of all, there's the secrecy and stigma behind child protective services in general. There is the black mark of being accused of child abuse or neglect solely over marijuana use, especially if substantiated. There are child abuse registries, and basically those have little to no oversight or ability to appeal. If parent is substantiated as being guilty of child abuse or neglect, they will be put on a child abuse state registry in most states, and these have little to no oversight or ability to appeal. The records can be kept for like 15 to 30 years. And this will affect a parent's ability to take certain jobs and even go on their children's field trips for their children's entire education. There is Drug Endangered Children, or DEC propaganda, and what that is it's a national organization with offices in many states. They're trying specifically to keep marijuana use by parents as child abuse and or neglect, plus add criminal charges of child endangerment when cannabis is used in the home. That's even if the child isn't home at the time. And especially when there is cultivation taking place. And that's even if it's kept away from kids under lock and key. They even have a federal task force about this. Third rail treatment and stigmatization by marijuana and drug policy reformers, which often is like ignoring the issues, throwing parents under the bus, in legislation ostensibly meant to keep marijuana away from minors, which is appropriate, but you also need to understand that there are parents who have marijuana in the home that they do keep away from their kids. Failure to include parenting issues in legislation, often to avoid anything deemed controversial in a bill, which is a general problem with civil protections. And a denial of medical marijuana recommendation or medicine due to breastfeeding or children in the home, and particular stigma towards people of color, the low income, and disabled who use medical marijuana. There's also a lot of stigma over pregnancy and people who use medical marijuana during pregnancy, whether that's for pregnancy or whether that's for an ailment which they would have regardless of their pregnancy. The first issue of that is substance-exposed newborns, also called SENS, which is basically the mere presence of cannabis or its metabolites in non-confirmatory drug testing is used to call a baby a SEN despite any lack of scientific evidence of any withdrawal symptoms or actually any discernible effect at all, which can cause a mother and child to be separated, force cessation of breastfeeding, involvement of child protective services, and of course a stigmatizing label applied to both mother and baby from birth. And the next one is the new crack babies. Even worse and more scientific, especially since there was actually no crack baby crisis in the first place, is a new Fox News-fueled moral panic about babies exposed to marijuana in the womb being the new crack babies. There's been a lot of articles recently about this. It's been gaining traction recently. And personhood legislation, which is redefining a person to include fertilized eggs, embryos, and fetuses, which is then used to apply child welfare and the DEC laws I just spoke about to the unborn. And speaking about that for a minute, Alabama judiciously rewrote their DEC law to apply to fetuses from the moment of conception. They used the drug endangered children legislation to do this. What it does is create a de facto personhood law and advance a different political agenda. 20% of arrests under this law in Alabama are for pregnant women who solely use marijuana. And meanwhile, Tennessee has a law that makes the use of marijuana while pregnant to be fetal assault. Also, another problem in pregnancy is denial of medical marijuana recommendations or medicine due to pregnancy or breastfeeding, or denial of breastfeeding in the postnatal hospital setting where women are told that they can't breastfeed their child because they use medical marijuana. Also in the hospital, drug testing without consent and CPS threats by the prenatal care provider, guaranteed drug testing of the newborn with positive drug test or self-disclosure during pregnancy, or quote-unquote random tests after birth, but like I previously mentioned, low-income, disabled, and people of color are more likely to be quote-unquote randomly tested. There are a lot of legal risks, and I'll try to get through this as quickly as I can. There's mandated anonymous reporting to CPS. Well, mandated reporters are professionals required to report marijuana use, even if they don't want to, and even if it's medical, like a teacher or coach or even a medical professional who may be treating you for with medical marijuana. I know, which is strange, but they actually technically have to report if you're a parent and you're using it. Anonymous reports can be made by anyone with an axe to grind, such as an ex or a landlord, and some states make everybody mandated reporters. If a mandated reporter fails to report, they can face fines and or jail time. CPS actions are assessment or investigation to decide whether you are neglectful or abusing your child simply because you use your medical marijuana. Substantiation of child abuse and or neglect allegations when they say, yes, well, actually, you are guilty of child abuse or neglect. Service plans, which can take the random or regular drug testing. They can send you to rehab or substance abuse programs, parenting classes. They can send you to court, and the court can take dependency, which is the court decides about the care and custody of your child. They can remove the child from the home, and they can even terminate parental rights. Regarding termination of parental rights, this actually can happen much more quickly than you'd think. Sometimes as little as a year before of a child being taken from the home and in foster care before they try to terminate parental rights, and the child is put up for adoption or adopted out into the foster home. In some states, the bonding with an alternate caregiver can be used as a reason to terminate if a child bonds with their foster parent, even if the parent, for instance, does all what they're supposed to do. They go through all the programs, they finish their service plan completely. That can be used as a reason to withhold their child. And many states have no appeal over termination of parental rights. And a lot of states, once it's gone, it's gone. Divorce and custody cases, anything probably can and will be used against a parent in a custody case, including medical use of marijuana. It can and does trigger penalties of financial child support, being limited to supervised versus unsupervised visitation with their children, loss of custody, or complete loss of parental access. Family court can actually make their own service plan or treatment plan for a cannabis-using parent and punish them for noncompliance. Marijuana use by a parent can require negotiation and compromise, even where there's domestic violence present, to avoid greater risk of demands put on the parent by a judge or indeed a report to CPS because of the custody case. And court proceedings take place in family or juvenile courts, which are civil courts. Many due process protections, including the right to counsel and basic procedures, are not automatic rights, and they do not apply in many states' proceedings. Proceedings are closed to the public, and decisions are often unpublished, sealed, and confidential, which prevents public oversight and accountability, and there's very little recourse for any of this, and that will keep coming up. There's very little recourse for any of this. This is the scope of the problem. This is our data from 2013 to mid-March 2015. We're the only ones keeping data on this. The Alabama arrests are actually 2005 to present, that you see the black diamonds down there. And this includes also a small amount of cases from 2010 to 2013. And due to the structure of the map, what you can't see is there is a significant amount of further map marks behind the ones you can see on the small scale map. There are actually hundreds of cases here. You can definitely see where there's bits that there are specific problems, like in Colorado, Washington, California, Massachusetts, Florida, and Texas. But we have heard from parents in nearly every state, and we hear from more and more parents on a daily basis. And one of the reasons for this is follow the money. Now, compliance with CAPTA provides federal funding. CAPTA is a federal law, but state officials merely have to say they're complying with the Act. I could spend another 15 minutes to an hour just talking to you about the intricacies and vulgarities of CAPTA. There are other lucrative financial incentives and one-off payments for service plans and removal. States provide additional money to CPS departments, and private for-profit companies administering the drug testing, the drug rehab, the supervised visitation, and even foster care. My organization, FLCA, this is how we challenge the stigma. And we offer direct assistance to pregnant women and parents. In just 2014, we helped 200 families in 30 states, most on an ongoing basis. We offer educational materials such as the 50 State Profiles Project, explaining the laws, regulations, and policies regarding marijuana, CPS, and courts for each state and national page, how to handle CPS, fact sheets for lobbying legislators, and more. We collect peer-reviewed clinical studies on prenatal exposure, breastfeeding, environmental exposure, drug testing, pediatric cannabis use, and more. We have a legal network, including a free attorney referral network and referrals, pro bono legal research, affidavits and letters of support, and expert testimony, especially in termination of parental rights cases. We do have people who can fly out and testify. We also offer model language for parent protective provisions and ballot initiatives and legislation. Our website, by the way, is FLCalliance.org. Now, there are existing parent protective provisions, and I won't read each of those to you. But in Michigan, the Michigan Attorney General tore this completely apart. He limited its protections, removed parents from general protections afforded to all patients, as well as from using an affirmative defense, which everyone else in Michigan gets to use. Parents don't get to use affirmative defense. And implied CPS should investigate every medical marijuana using patient to ensure that doesn't create an unreasonable danger. Saying if it creates an unreasonable danger to the minor that can be clearly articulated and substantiated, basically says, let's investigate everybody to find out if there's a danger. Where it should be, if there's a danger, let's investigate. Washington has a provision that is primarily useful in custody, can't have their parenting time restricted. But again, it leaves it wide open to investigation, interpretation, and it has resulted in a number of adverse child custody decisions solely on the basis of medical cannabis use, as well as any number of CPS actions, as you saw from the map. Hold on one second. And in Massachusetts, there's a decriminalization law which says that marijuana cannot be used as a basis for any civil penalties explicitly such as not to deny someone from serving as a foster or adoptive parent, but it actually doesn't protect biological parents. So while there are parent protective provisions in the law, none of them actually really protect parents. Well, why do we need model legislation? As I said, existing parent protective language does not provide the real protections parents actually deserve. FLCA does offer model language, and each word choice in FLCA's language is to fully protect parents from experiencing assessments, investigations, actions, and proceedings by CPS or in family or juvenile court regarding child welfare or custodial matters. It covers the whole thing. It fully ties the hands of CPS and courts regarding marijuana use. It provides the opportunity to bring appeals to court on the basis of this language and make case law providing precedent, which is hugely important. And it's also in ACE's model medical marijuana legislation online. This is our model legislation. Let's go the medical real quick. Neither the presence of cannabinoid components or metabolites in a person's bodily fluids or conduct related to the medical use of cannabis by a custodial or non-custodial parent, grandparent, pregnant woman, legal guardian, or other person charged with the well-being of a child shall form the sole or primary basis for any action or proceeding by a child welfare agency or in a family or juvenile court. This subsection shall apply only to conduct in compliance with this chapter. As you can see, this completely ties our hands, whether you're a custodial parent or whether you have joint custody, whether you're a grandparent who is a legal guardian, or you're just simply seeking your grandparent rights if the kids were taken away from the parents for marijuana use or for another reason, or a legal guardian, anyone who's charged with the well-being of a child, no one should be even investigated solely over medical marijuana use, because medical marijuana use doesn't make you a bad parent. Now, how can you help remove stigma and discrimination from parents and pregnant women who use medical marijuana? Well, you can welcome and support parents to your cannabis communities, organizations, and businesses. You can do education and work to raise public awareness. You can offer our flyers at dispensaries or events, for instance, or having a speaker come talk about this. You can, as a parent, you can come out of the cannabis closet. You can, I know it's a huge risk, so I understand that parents don't want to do it all the time, but you can come out and say, I'm a good parent. I go to the PTA. I go to my child's games. I help my child with their homework, and I also use medical cannabis for my own health. And so you can put a face to being a medical marijuana patient and a parent. You can include FLCA's model language in your ballot initiatives and legislation. You can support the work of FLCA and ASA, and you can make this a priority in your organizational agenda. Speak out against stigma in your communities. And basically, thanks so much for ASA for inviting me to speak as a representative of FLCA on parenting, pregnancy, and child protective services. I'm sorry, I just basically read off cards the whole time, but I appreciate that you all came to this and listened, so thank you so much.
Thank you, Sara. I'd now like to welcome to the podium a friend of mine and an inspiration for the organ transplant legislation in the state of California, the president of GLACA and an organ transplant survivor, Yamileth Bolanes.
Hello, everyone. My name is Yamileth Bolanes, and I'm from California, and I am a medical marijuana patient first and foremost. In 1996, I had a complete liver transplant. About 4 years later, after having withered in pain for 4 years and had all kinds of accidents where I couldn't leave my house, I became a prisoner in my own home. Someone handed me a joint, and I reluctantly took it and smoked it. And it was the first time I had had relief in the 4 years since I had the transplant. So anyway, the rest is history. I found what was my medicine and what helped me, and I delved into it. I ended up opening a dispensary in Los Angeles to serve patients like myself, and then started GLACA. Meanwhile, in 2008, I was told at UCLA that because of my medical marijuana use, that if I happened to reject the liver, that I would not be transplanted again and that I would die. So in 2012, after Norman Smith died out of Cedars-Sinai, I got very nervous and was at the time admitted to the hospital for another problem that had nothing to do with my liver. 2 days later, when I was told that I could leave, I left with the recommendation to use marijuana 3 times a day by the doctors that discharged me. So walking out of the hospital, I called Don and I said, Don, we have it. How could they tell me in 2008 that I would not be transplanted if I kept using medical marijuana, and today the doctors just discharged me with the recommendation that I use it 3 times a day? Oh my, I'm confused. What does this mean? You know, the same hospital's contradicting. So Don had what he needed to write a bill, and we've been pushing it for the last 3 years. The first time that we went to Sacramento, they told us that they couldn't support it because it was too controversial. Saving lives was controversial in California. We've been pushing and pushing and pushing, and in December of last year, the California Medical Association voted unanimously that using marijuana should not be a reason for people to be dismissed from the transplant list or from the program. So that was wonderful. And because science knew that marijuana is good for you when you're sick and it helps your body and it helps you be healthy, then when we told the state legislators that the CMA had voted unanimously for marijuana, then they decided that it was a good idea to support it. So 3 days after the unanimous resolution was voted unanimously, we had an author. And in fact, now we have 3. So that's wonderful. And on April 7th, we're going to the Health Committee to testify about the good things about medical marijuana. Dr. Larry Bertard is going to testify along with me, and we hope that we can make a difference. We hope that this is a no-brainer for the legislature. This bill will not cost anyone any money, which is a good thing, except for ASA that's, running the campaign. And it's not going to make anybody any money, which happens to be the biggest reason why people fight in this industry. So this should be a no-brainer for all Californians. And the entire community of medical marijuana should get behind this and show the state just how much power we do have, because this is something that we all can get behind. In San Francisco, at Stanford University, Richard Hawthorne was taken off the list about 4 months ago because of his use of medical marijuana. In San Diego, we have a gentleman by the name of Justin Turley also taken off the list because of his use of medical marijuana. In Los Angeles, we have a lady by the name of Mary Trujillo, and ASA was able to get her back on the list at Cedars-Sinai. But I have a patient also at Cedars-Sinai that's been on dialysis for 6 years, and they just made her sign a contract 2 weeks ago that she would not use medical marijuana so she could get her opiates. Every time I talk to her, she's in tears. Every time I talk to her, she tells me that she's praying so hard that this bill passes because it'll literally save her. She's in so much pain. She's so distressed about not being able to use it. And the opiates that they give her, anyone that's been sick and knows about using opiates, all they do is constipate her and give her more pain. And this is unacceptable. It's unacceptable that in 35 states that have, plus the District of Columbia, that have medical marijuana, some kind of legislation, that there's only 6 states that protect transplant patients. This is unacceptable. And you guys should, those of you that are from California or part of an organization or not part of an organization should be writing a letter of support to the Health Committee in California supporting this bill. And those of you that don't live in California should go push for this same kind of ending of discrimination against medical marijuana patients in your own states. Thank you.
Thank you, Yami. Yes on AB 258. So next I'd like to introduce Stacia Cosner from Students for Sensible Drug Policy. Stacia.
Hello. I'm Stacia Cosner, Deputy Director of Students for Sensible Drug Policy, and I just want to say thank you for having me here today and for organizing this great conference. It's a great honor to be up here next to these awesome activist warriors. So today I'm going to be talking about something a little bit different from the other panelists. I'm going to be talking about policies that specifically target young people and students. I'm going to talk about the stereotypes that cannabis activists face and about my experience as a student and being a student activist. In 2006, I was a freshman at the University of Maryland, and like many young people, I made the ill-fated decision to smoke marijuana in my dorm room. I was by myself in my pajamas when I heard a knock at the door. Knowing nothing about my rights, never having experienced a police encounter before, I let them in and immediately turned over all of the contraband I had, which was a small pipe and less than a gram of cannabis. The next few hours would certainly change my life, and I would not be here today if I hadn't had this experience. They searched every inch of my dorm room, forced me to change my clothes in full view of several officers, while making a big scene as they marched me out in handcuffs as if I was a drug kingpin. At the police station, the officers laughed at me as I cried, making fun of the college girl that got caught smoking pot. I was put in 5-point shackles around my waist, my ankles, and my wrists, and as I was fingerprinted and taken around, had my mugshot taken. Fortunately, my criminal charges were dropped, but I spent the next 2 years navigating the campus judicial system. I was kicked out of my dorm. I was banned from ever living on campus again. I was put on deferred suspension, meaning if I didn't comply with the school's laundry list of requirements, then I would be suspended. Some of those requirements were voluntarily enrolling myself in a substance abuse intervention program, attending AA and NA meetings, writing all kinds of essays about how terrible of a person I was and about how much of a danger I was to the community. They put me on random drug testing for 2 years, all at my out-of-pocket expense. They treated me like a criminal, like a drug addict, like a danger to my community, and it really, catalyzed my involvement in this movement. I'd been a supporter of drug policy reform before that incident, but afterwards, my involvement with the movement, especially with Students for Sensible Drug Policy, really skyrocketed. And in SSDP, I found a community of people, shared my passionate belief that the war on drugs has failed, and alternative approaches are not only possible but necessary. Being arrested certainly ignited my passion, but it also added to my personal stigma as an advocate for policy change. I went to great lengths to keep the news of my arrest from my parents and from campus policymakers because I didn't want them to stereotype or to stigmatize me. I felt like they would write off my activism as self-serving and write off my credibility as someone who was pushing for political change, and therefore they wouldn't be receptive to changing their opinion on the issue. But even for those who haven't had such an experience, being a student activist for this issue can unfortunately make you a target of campus administration and of law enforcement. I'm not saying, to be clear, that student activists should be paranoid. It's extremely unlikely that, campus administrators or police have the desire, time, or resources to monitor your every communication and, surveil you 24 hours a day. But a much more likely scenario is one in which a school administration will, make it difficult for a group that organizes around this issue to become recognized as an official student group, or to receive school funding, or to reserve meetings and event space, forbid you from printing T-shirts with cannabis leaves on them, or with any kind of messaging around this, or even flyers, or otherwise just push back against this political activity. And let me be really clear, at public institutions, this is illegal and unconstitutional. Let me repeat that, it's really important. At public institutions, it is illegal and unconstitutional to prevent people from organizing around this issue. And it's, as activists, it's our responsibilities to defend our rights in these situations. Your right to associate with and speak your mind about political causes is protected by the First Amendment, and it's our responsibility to stand up to anybody that tries to infringe upon that. Let's give it up. So for those of you who are working on a campus or school environment, don't let campus administrators intimidate you. Politely assert the facts when they're on your side. Research the rules for campus groups, events, and campaigns, and make sure that you follow them. And if and when the situation escalates, call in the big guns, call the national organization's offices. There's a lot of people out there who can help you when people are trying to stand in the way of this political work. The ACLU, of course, other reform groups, headquarters. There's a great group specifically for on-campus things like this called FIRE, Foundation for Individual Rights and Education. They get involved with legal action against these schools whenever there are free speech violations, things of that nature. They helped out one Students for Sensible Drug Policy chapter a few years ago. Northern Illinois University, their school was trying to tell them that they couldn't form a group because of the subject matter. We said, no, you are a public institution. You're just not allowed to do that. So they brought in some attorneys and were able to get the school, the SSDP chapter recognized. And they also worked with a normal chapter whose school wouldn't reimburse them for printing T-shirts with cannabis leaves on them. They were able to be successful in that case as well. So again, that group is FIRE, Foundation for Individual Rights in Education, and they're certainly a great resource. So, how does this apply to the medical cannabis work that you all are doing? I think that we can, learn a lot about how to combat these kind of discriminatory policies. For example, the Higher Education Act aid elimination penalty. Is anybody familiar with that provision? No, not at all, huh? I see Justin Kander back there. You guys certainly are. Great. So SSDP was actually founded in response to the Higher Education Act aid elimination penalty, which requires you to check a box on your financial aid form saying if you've ever been convicted of a drug charge. It doesn't ask you if you've ever been convicted of rape or arson or murder. Just asks if you've been convicted of a drug charge, and that will render you ineligible if you're receiving aid at the time that you receive the charge. School bureaucracies are enormously complicated, and it's very difficult to understand how to regain your eligibility after such a drug charge. It's also important to note that even in states that have very strong and positive medical cannabis laws, on campus, that's really not the case. Schools are very afraid to, allow students who are medical cannabis patients to use that safely on campus, and there's basically no protections for them on campus. It's basically treated like someone who is using non-medically, and in many schools, marijuana is just lumped in with all of the other drugs, and they just have a policy that says no drugs, any drug charge, you're out of here. So a lot of SSDP chapters do work around that to sort of carve out protections for medical cannabis patients and also to reduce the sanctions for getting caught on campus violating these marijuana laws. So as cannabis activists, what are some stereotypes? Shout them out about cannabis activists. I know you guys have heard them. Hippies. They're hippies. Exactly. Lazy, unprofessional. Precisely. You guys get what I'm talking about. You know what I'm talking about. So I guess how do we combat that, right? And there are a few ways that we can do that. While we work on changing these discriminatory policies, we can also change hearts and minds through telling your stories, telling people you meet on the street and campus administrators and people that you interact with, so that there's a human element there, and show people that these policies have real impacts on people's lives. And don't be afraid to share your story with any and everyone, because that's how we are going to win this war, is through these one-to-one interactions, as Don mentioned earlier. And as advocates for this controversial issue, it's important that we're 150% polished, professional, and prepared. It's important to keep in mind your attire and appearance. A conservative Republican who's on the fence about this is probably not going to be persuaded by somebody with dreadlocks wearing a tie-dye T-shirt. It's just the facts of the matter. And it's not like we are telling you not to be yourselves or anything. It's just when you're going into that meeting, maybe put the suit on, maybe pull the hair back and put your best face forward, because we don't want our message to get lost because someone is stigmatizing or stereotyping you before you even open your mouth. It's important to be respectful and, use a respectful tone. It's, there's a very fine line between being passionate and being indignant. And we, as activists, it's important that we keep our emotions in check so that our messaging doesn't get lost in the way that we present ourselves. I'm reminded of a line in The Big Lebowski, and it's where the dude says, "You're not wrong, Walter, you're just an asshole." So we don't want to be that, right? And of course, be knowledgeable about the policy change process, the deadlines, the rules, making sure that you're working within this system to change things. And actively engage with the community. Don't only show up when there's a cannabis thing on the docket. Be an active member of the community. Show that you care about all political issues and things that affect people, not just things that you're most passionate about. And so in conclusion, I would say be aware of your rights and how to respond if and when those are violated in this line of work. Continue to fight the stigma and challenge stereotypes by telling your story, by building a carefully crafted reputation and your credibility. Take advantage of those one-on-one interactions and allow people to see the full picture, that you're more than just a cannabis activist. You're also I'm a daughter, I was a student, I play softball, I like to paint, making these stakeholders see a fuller picture so that they can relate to you and more easily be receptive to our message. And then in closing, I just think that you guys should keep up the great work. So thank you.
Thank you, Stacia. And thank you to all the panelists for the wonderful comments. If we had 2 hours for this, we could probably fill it up with terrible stories of discrimination against medical cannabis patients. I do want to take some time for questions. I want to remind you that we have 10 minutes. So in order to get in as many questions as possible, keep it short. Please don't repeat one another. And this is not the time for autobiography. We're asking questions or making comments. Yes, right over here. And speak up, please. Yes.
I saw that New Mexico was not on the map where there was your bullets about the pregnancy and the family. I'm sorry, I'm a little nervous. Anyway, I wanted to point out something that's happening in New Mexico about using opiates. We have had the highest overdose rate in New Mexico for opiates. Now they're doing reverse drug testing. If you're prescribed a medication, you're randomly drug tested to make sure that you're the one that's taking it and that you're not selling it. And I'm a medical cannabis patient. I also do still, for breakthrough pain, use some opiates. This time when I was randomly drug tested, they said, "Oh, the cannabis didn't show up in your system. Are you sure that you're not selling it?"
Wow.
I really like my nurse practitioner, but because of the laws in New Mexico, she had to ask that question, and it's just really horrible to have that kind of discrimination.
That's intrusion, of course, into your healthcare. How weird that you're supposed to test dirty now. That's strange. Fred.
I wanted to ask if Students for Sensible Drug Policy has ever made demands on student health services to approve or recommend cannabis as an alternative to Prozac, etc.
The short answer is no. We've not done that specifically, but we're certainly moving more toward looking into how we can protect medical cannabis patients who are students. I want to give a quick shout out to Nick Rosenberg. Say hi, Nick. He wrote a wonderful memo on medical cannabis on campus and the legal barriers that are there. Long story short, it's immeasurably complicated, but if you have any thoughts on that or want to discuss it more with Nick and help us develop that, we would certainly welcome it.
Other comments? Yes, Larry?
Yeah. Do you know of any state laws that would have the same effect for alcohol, i.e., if you're diagnosed as an alcoholic, we're going to take away your kids? Any state laws focus on alcohol?
No, because alcohol is legal and established, and they can't really go after. I mean, in theory, if someone has an alcohol problem, in addition to some other form of neglect or abuse, CPS could make that an issue, but they can't make alcohol. So, like, if a parent has an alcohol addiction, they couldn't make that an issue by itself in the same way that they can for a medical cannabis patient.
alcohol does cause fetal alcohol syndrome.
Oh yeah, and it does. And for in the hospital, for substance-exposed newborns, sometimes they will count that, but normally that's just something that medical professionals take care of instead of child protective services, which is, if there's a problem with marijuana use, also how that should be done. But certainly, where someone is a medical marijuana user and using it for their illnesses, that obviously should not be the case.
Lenny?
Do women who use midwives and have home childbirth have the same discriminatory
That's
problem?
actually a really good question. Home births are often a way to get around that problem. One thing I didn't mention in my presentation is I've been investigated 3 times for my own medical marijuana use, and my second child was born at home and wasn't the 4th time. But I was very lucky because I was able to find midwives who were able to do it on a sliding scale and on a bartering system, so I could afford to have a home birth. Home births are not really available to a lot of women, and there's still a risk because if there's complications, you may end up in the hospital, and then you may end up being drug tested anyway. And while most midwives are more understanding of medical cannabis use and may even recommend it, that's not always the case either.
On the other side of the table, and then I'll come back over here. Yes?
I wanted to ask a question to Stacia. When trying to get colleges and their SSDP programs, I guess, involved more, do you have suggestions on your websites or anything like that that would give ideas for events? Because something we hear a lot is, well, like, what are we going to do? Like, just throw a fundraiser? Like, do you have ideas for them to get involved?
Oh yeah, absolutely. We have a laundry list of resources on our website, including a whole student organizing manual that has a lot on those types of events. ssdp.org/resources is where you would find that. That's ssdp.org/resources, and I'd be happy to speak with you after privately.
Great, thank you.
Yes, in the front?
For SSDP too. You mentioned other issues and also the free speech thing. Have you run into any issues with the free speech zones, and what's your opinion about on campus?
Sure, we have indeed. They're very strange. I don't know as much about them as I probably should. As I mentioned, that organization FIRE does a lot of work around the free speech zones, and it's sort of an attempt for the school administrators to put like a Band-Aid on it. It's actually kind of a perverse thing if you think about it, because they're like, okay, so this is the 10 feet where you have free speech, and if you're not in that 10 feet, then you don't have that. I think it's pretty silly that they would try to carve that out in that way. But yeah, they certainly is some overlap here, but I think that they're silly.
Other comments, questions, experiences to share? Suggestions for overcoming stigma? Where? Oh, up here. I'm sorry. I don't mean to forget about you guys.
This is more for Stacia and the rest of the people here. I'm actually a student at Anne Arundel Community College. First time ever class in medical marijuana and entrepreneurial opportunities. So we are talking about all these things openly. It's a 3-credit course, and probably the first or second in the country. So there is progress being made, and I'm sure that our professor and all the students in the class would love to have you come as a guest speaker.
That's great. Oh.
So I wanted to make you all aware of that.
Wonderful. Let me take one last question, also put the next panelist on notice that it's time to gather your stuff. Anyone else? Question, comment, or experience to share? Suggestion? Anybody? Is there anyone who wants to tell a duck joke I have not told already at this conference? No? All right, well, I want to thank the panel. Thank you for your time today. And next up, we have updates on clinical applications. So next panel, come on down.